Roland, it's always such a honor and really for me a fun time sitting down with you. Every conversation we've had has added a lot of context for me personally into what the healthcare system looks like, not only in the Western Cape but nationally across the country. Maybe for those in the audience that and are listening and are watching that don't know who you are, could you maybe just explain to us exactly where Dr. Roland Kroukamp comes from, what your credentials are, and what your special interests are within medicine?
Thanks for having me as a guest. I'm Roland Kroukamp. I'm a specialist family physician here at Michell's Plain CHC. I come from Grabo. I was born in Grabo, raised in Grabo, and then left Grabo to go and study and just never returned. I only return nowadays as a visitor. And I'm a qualified family physician. As I mentioned, qualified MBCHB in 2006 at University of Stellenbosch. The MEd in family medicine was in 2014 through the College of Medicine as well as University of Stellenbosch. And my special interest is sports medicine. And I've done an MPhil in sports and exercise medicine, which I'm very close to finishing. But very exciting field, and I think it's a good marriage between family medicine and sports medicine. They are so similar and so alike, and the world of sports medicine is a lot more specialized, which I'm really excited about. Lots of technology involved in that, as well as innovation, which probably brings us to today's talk. So that's my background, but I would want to add that I think probably the things most important to me in why I am today is because of how my parents raised me. I think those are the two most important people up to date in my life for the foundation that they have built and set before I went to school. And most importantly might not be for all people, but for me, probably my primary school years and my secondary school years, because I think my parents, with both primary and secondary school years, is what actually laid the foundation and instilled some values in me, which I carried with me until today.
That's fantastic. It's always good to hear those kind of stories, and I think just South Africa could be such a great country. Not that it isn't already, but we could be so much better if we had strong households and strong families that were at the root of our society. And we see so much fatherlessness, we see so many broken homes in South Africa. And I mean, you're a testament to a good upbringing and just what's possible, when one has that backing behind them. But what brings us here is we're sitting today at Michell's Plain CHC, and you lead the clinical team here at Michell's Plain CHC. Maybe just talk to us a little bit about what you do here at Michell's Plain CHC and what your roles and responsibilities are.
Okay, so my role here is I'm the only specialist at PHC facility, and that holds true for all PHC facilities in the Western Cape, if not in the country. My main role is clinical governance, strategizing, innovation, making sure that clinical services are streamlined and that we can help the most amount of people with the available resources. But it's not a one-person functionality. I must say I work with an excellent team of other operational managers and other specialities like pharmacy, allied health. And as a team, it is possible for me to actually lead my clinical team with inputs from all of these various entities. And important to note that at a big facility like this, it's vital for you guys to work well together as a team. We might not like each other. Some people might not like each other, but I always feel it's really important to be able to tolerate each other and put the common goal first and do away with personal things that might exist.
Yeah, I think that's common
among colleagues. Yeah,
across any kind of facility, across any company, really, is that you're not always going to have personalities that like each other the best. But if you can work together toward a goal, then you can do a lot of good for a lot of people. You mentioned something there. I said CHC, you said PHC. That it just in that already. We were having a conversation before this podcast about the lack of understanding
Yeah.
of the different levels of healthcare that exists within the public sector, and that even there's different healthcare structures within different provinces. So maybe for the person who doesn't understand how public healthcare is structured, maybe just give us a crash course on the different levels of healthcare from PHC all the way through to tertiary. What are the levels and how do they work together?
Okay, that's an excellent question. I think the Western Cape might differ from the rest of the provinces in South Africa. So in the Western Cape, we've got different levels of care. And we always talk about seeing the right patient at the right level of care. And that's important because if someone ends up at the wrong point to receive clinical care, it might lead to lengthened waiting periods. So we're at the primary healthcare facility, which is all CHCs and all CDCs. And something that I don't want to ignore and forget is a bit that I spoke to you a little bit earlier about community healthcare workers.
Very important. Yeah.
They are super important to the primary healthcare system. I would go as far as saying they are definitely an extension of the primary healthcare system because they are our feet, our ears, and our eyes that's right in the community where we cannot be present. And quite often patients are lost within the primary healthcare system. And we can pick those clients up by our safety net, which is our community healthcare workers in the community. And they've got a vast role to play. And they are not often recognized as the heroes of the healthcare system, but they are really important for us to be able to actually fulfill our function at primary healthcare level. Then we get district levels, which is hospitals that's got specialists in their system, but not super specializing. And then we have our specialist hospitals like our Tygerberg Hospital, Red Cross Hospital, and our Groote Skeers. And there's a referral pathway in terms of usually at primary healthcare, most of our patients get the majority of their care, and most of the time non-urgent care, preventative care is the cornerstone of what we do at primary healthcare. So should we pick up something that the client need more specialist type of care, there's usually a referral pathway depending on which substructure you work in.
Yes.
There's different pathways depending on which is your specialist hospitals, and usually you follow your referral pathway so that the right client that needs specialist care will be seen at the right point of care,
level,
which is at your specialist level.
So
and that's how everyone in the system, in the public health space, understands the system, and we all have to adhere to referral pathways.
And just to clarify, I mean, if I'm understanding this correctly, so you have your community healthcare workers, they're present within the community. They see on the ground what's happening, oftentimes even providing care in areas or spaces where care cannot be given by the primary healthcare worker or primary healthcare facility rather. Then you have CHC or PHC where we are currently at, which is preventative care. Then you've got your district, which is more where there might be a specialist present there. Would there be operations happening at a facility like that sometimes?
Yes.
Yeah.
District level hospitals has got a variety of theatres, so they can do various type of surgeries, except the highly specialized type of surgeries.
Yes.
If I can use our district hospital close here, they can perform laparotomies, they can perform cesarean sections, they can perform tonsillectomies, they can perform orthopedic type surgeries. So really a lot can be done at district level before referral to a specialist service is warranted.
All right. So with that being said, we are now sitting in the biggest, largest CHC in the country, definitely in the Western Cape and in the country, as you recently confirmed to me. What is it like leading a clinical team that serves a population of over 1 million people?
Look, it's exciting, but it is challenging. It is challenging in a big way because of the purely numbers game, if you can put it that way. Not fair to say the clients in terms of numbers, but the demand on the services are quite high. And in terms of resources, we'll have to re-strategize, and sometimes we have to innovate to be able to match the demand. And I think the exciting thing for me is because the facility is so busy, there's a lot of opportunity to innovate and to look at things differently and find ways to actually implement things that will result in better outcome for the biggest number of clients that we see. So it is busy. Sometimes it can be quite challenging and can be emotionally overwhelming. But I'm a firm believer, if you work at a facility like this, if you're not motivated to want to make a change, then you should question why you're actually at a facility like this. In fact, if you work at any public healthcare facility, your motivation should be wanting to make a difference in whichever way, shape, or form. And for the longest time that I've been here, for 6 years now, that has been the flame that keeps me going and the flame that keeps me waking up every morning. So,
and that flame burns bright still. I mean, I've known you for quite some time now, and one of the biggest contentions I've heard in public service workers is that they feel a sense of stagnation. They feel a sense of boredom almost, and they feel almost stuck in their role within the public sector. Yet you find new ways to reinvent yourself and your motivation, and I think it probably stems from that level of that desire for innovation that you've expressed here today. I mean, it's just so sad to hear that sometimes healthcare workers feel a bit stuck because they feel like they can't really express the level of health, or they can't really express their full passion for healthcare because they're stifled by the tools that they have around them or the systems that they find themselves in. And I guess you met with this firsthand because you are a leader within a facility like this, and your leadership style is quite hands-on. I've seen you in the wards talking to your colleagues, and you're very compassionate in the way that you deal with them. You're very empathetic in the way that you listen to them. That leadership style and that empathy that you have, where does it come from, and what continues to drive you to be a better leader every day for your team?
So, I think at the start of the interview, I said the way I was raised, and I always keep telling that to the younger generation of doctors coming through, that yes, university can teach you a lot of knowledge, but the character, how you were raised, values instilled in you,
sure,
how you were schooled, all of those things, at the end of the day, other things going to define your character as a person and your values as a person. So for me, that's the start of it all. Number two is if you work in an environment where the management or your facility manager, your direct supervisor are open to innovation and change, and you are almost on the same page in terms of, if we want to get better results, we need to do things differently. If we keep on doing things the same way, we will end up with the same results. And for me, that's quite exciting, because every time you get faced with a new challenge, there's a blank canvas, and there's an opportunity for you to actually paint something different.
Yes.
And different people can give their input. And I must say, the management team itself at a facility like this, they made it possible for me to express myself. And amongst that, you also identify strong leadership qualities in your colleagues and other things that they're good at. And the nice thing about discovering that is now you can start utilizing them for the newfound sort of values that you never knew existed.
They say good leaders create good leaders, so it's important that you find that.
That's the nice thing about it, yes. So for me, that's quite nice. And if you work in a team where everyone's input are valued, to me that's massive. I don't care if you're the cleaner or if you are the person, let's say, doing the vitals. Your input is important. And I think in terms of management and leadership, I think that's important to value other people's opinion as well. Because like I said at the start of the interview, there's no I in team.
Yeah.
And for me, work as a team and different team members, to me, that's so important in order for you to actually be able to do something successfully. So for me, that's all being positive, my previous facility managers had a huge impact on my leadership development. I wouldn't say I'm the same leader as what C was, but there's bits and pieces from a leadership style that for me was quite eye-opening, and things that I've taken on board. And we've got various good leaders in our department.
It's nice that you can rely on those.
There's really good leaders, and our HOD of Health, Dr. Keith Clutie, brilliant leader. You can learn so much from the way he does things. And to me, I mean, if that's your leader, it's very difficult to ignore that. You'll pick up some of those qualities.
Well, I hope I can have a conversation with him one day and just find out from him as well, on a provincial level, what might be some of the challenges he has to face. Because again, on the ground here, he's supported by leaders like yourself, that are implementing what's happening from a provincial level, and you can see that with the resources you have, you guys are certainly doing the best with it. But that also leaves ground for innovation. You mentioned this earlier, and this is a big part of what motivates you and drives you every day. And I'd like to just mention some of the innovations. And you actually showed this to me in its conception a couple of years ago. There was a resuscitation box that you had come up with, and even innovating at the level of the chronic care as well. There are some unique innovations that you've also received awards for, and I'd like to speak a little bit about that. But before we get to that, you have a knack for spotting these problems before they come up. Where does that come from, and what do you think is necessary for healthcare providers to be able to go from the idea of seeing the problem to then thinking, okay, maybe I can come up with a solution to that problem, to then creating a framework for the problem and then ultimately implementing it? Like, what was the process you went through when you came up with these various innovations that you've even received some awards for?
Okay. So one way of spotting places you can improve, obviously, if you're working at a facility which sees about 1,000 feet through the doors every day, you have got a high hit rate to receive complaints. Complaints is one of those avenues that highlights the gaps that we have. And sometimes it is gaps that we are aware of. So complaints is one way to look at it. And another way is sometimes you need to step back. If you're not constantly the frontline clinician and you are allowed to step back a bit and you see the bigger picture, it's very easy to spot the low-hanging fruit. And if you spot the low-hanging fruit, you don't change the system, but you make minor tweaks to it. And for me, that's a huge win if you can counter the low-hanging fruit before you put big plans in action in terms of changing the way the clinicians work. And to me, that's important. Whenever you change something, it must be a seamless change. It must be a change that's quite accommodating to them, which means that it's easy for them to just incorporate it than having to do another step that takes you 10 or 15 minutes more.
Every change in healthcare needs to earn its place.
Yes.
We have to test, we have to check compliance, we have to make sure that, because there are big, there are large things at stake. We can't just make changes for change's sake. So
and sometimes we want to make big changes. It involves funds, and we know that funding is a massive problem currently. So you want to work with the low-hanging fruit if you don't have the complaints, and you make small changes, and you have to be upfront with the whole team about it when you want to make changes, and you first have to see the bigger picture with them.
Yes.
The end goal.
Yeah.
Before you work your way back. And they all need to buy in, because whatever you implement will not be successful if your team are not on board with you and they understand what is the end goal.
Yes.
Or what is the bigger picture. Once you've done that, you've got to sort at changing things and changing behavior. And sometimes it takes a while. People are not easy with change. And over the last years, and I think with COVID pushed us to adopt change much quicker. Yes, it pushed us to adopt change much quicker. And after COVID, it has been a bit easier to implement new things. But you have to take into account how is it going to affect the service user, how is it going to affect the staff providing the service. So it can't be a negative on the staff providing the service and we want to create better outcome from the patient. So it have to serve both of them equally. Like staff will adapt the innovation if they can see that it's going to benefit the outcomes for the patient, and it doesn't take considerably more time for them or a lot of work outside just to get the innovation going.
Maybe just on a sidebar question on that one is, sometimes when we try and introduce innovation, we get a lot of initial pushback against it because change is scary and we don't want to do that. But if you believe in an idea, how do you know when it's a good time to stop or when it's a good time to keep pushing through and see this idea to its end goal, to fruition? Because we can be sometimes so disheartened for innovation in the healthcare sector because we get so much pushback for it. Mm-hmm. But when have you found that, if I just keep staying the course, or if I just do this activity, or I just, if I do it myself and I show that I'm willing to go through the change with them, that maybe then we'll get some buy-in from people. When is it a good time to keep pushing, and when is it a good time to say, hey, listen, I don't think I'm going to win here?
I think timing is super important when you introduce something new. Sometimes facilities or workforces go through change, and a lot of change at the same time. Maybe when you want to introduce something new, it might not be the best time, so timing is important. And if I get a lot of pushback, I try to find common ground. If someone doesn't necessarily agree with me on a particular topic, it doesn't have to be an innovation, just in terms of management plan, and I ask them, but why not? I'm not saying you're wrong, but just justify, or instead of saying it's not going to work, what will make it work? Change that, that negative to a constructive. We need you to tell me what will make this follow through. If what I'm proposing doesn't work, then people are involved in the decision making. You have to get them as part of the decision making. And I've also learned that over years, that once they're part of the decision making, they take ownership. And then it's easier for you because they understand it and they feel a part of what's about to be introduced.
I think there's so many people in the public. I think there's so many people in the public sector that have great ideas, but they bring the ideas to the fore. The ideas get shot down, or you get told there's no budget for that, no funding, or it's going to take too long to implement, and then they go to the graveyard to die. And so I asked that question because I know there's somebody listening to this right now, watching us, that possibly has that idea, and you might be able to inspire them to keep saying, listen, keep pushing through. Maybe it's a timing issue. Maybe it's a collaboration issue. Asking the question, so what will, get us to that level, might be the unlock that they're looking for, and it could make a big change, make a big difference. Yeah. One of the new technologies that you have a special interest in is point-of-care ultrasound.
Yeah.
This is something that is well documented, and you've aligned yourself in the past with organizations that are trying to innovate in this space. And so I want to ask you a question with regards to the implementations, with regards to your involvement in it, and with regards to adoption of new technologies in healthcare. What do you think it takes for what do you think a healthcare provider needs to see from a technology before they would consider adoption? And what drives your constant desire to want to find and unlock the potential of these new technologies?
That's quite a nice one, because I quite enjoy the new tech innovation in the healthcare space, and point of care ultrasound happens to be one of those. And I think my passion grew from sports medicine, seeing the value that it had. So with any innovation, one has to take into account, will it add value or not? Is it money well spent or not? And if I can use point of care ultrasound just as an example, there's no radiation, so it's safer for the patient. Lots of times we have to refer patients needing ultrasound for simple pathology, which you could have done at this level. And ultrasonographers are particularly very scarce in the public space. I do believe in the private space it's also a scarce resource. And in a system where the demand is quite high, where this population in Mitchell's Plain, which is massive, I think it adds a lot of value to be able to do some form of point-of-care ultrasound without having to refer patients into a system that's already overburdened higher up. massive demand, lack of resources. I'm a firm believer that primary healthcare, there is so much more that we can do. If there's a technology that permits us to do more for our clients at this level and completely manage our clients without having to refer them, I'm all for that. And many a times, public and private has been compared to each other. And I'm of the opinion for many years, it's not about the building. It's about the service, the patient-centered service that is provided. It doesn't matter what the building looks from the outside. And I think in the past, private and public sector has been frowned, more the public sector has been frowned upon by what the building looks like from the outside.
Yes, yeah.
But it's about that individualized care. And that's something very, very close to my heart, because I've got family members that's dependent on public facility care. And I always want to prove that it's not the building. It's about the patient-centered care. And in terms of the new innovation and technologies, there's AI on the horizon. Got huge interest in it, because I can see how it can benefit systems with a lot of patients but not enough resources.
Yes.
We can have so much more output in terms of service delivery using various tools. AI, once again, it's a tool. Ultrasound, the POCUS, the ultrasound POCUS. I use ultrasound every day in my day-to-day practice. If I do a minor surgical list, I scan everything, and it gives me a lot of satisfaction knowing the procedure that I'm going to do and what it is actually before I've done it. One of the things that I've been interested in specifically in point of care ultrasound lately is ultrasounding breast masses, which at our facility, a lot of the masses are benign, so it's not a cancer. And you can see various things by doing an ultrasound. There are a number of patients that needs to go for mammograms. That's high risk, but the low risk clients we can ultrasound, and if indeed it's got benign features, it's something that we can remove under local anesthetic at this level without having to refer them on. Where in the past all lumps has been sent to a breast clinic. Nowadays you can sort of screen them here already and decide who needs to be referred and who are those clients that we can manage.
Just the efficiencies it gives you is
a lot more efficiency, less pressure upstream, but it's very individualized in terms of, I'm always saying that clinicians should be motivated to become more skilled. And I think for you to be screened in point of care ultrasound should be one of those non-negotiable skills for primary healthcare, because it adds so much value. You can scan soft tissue or a joint in motion. You can't do it with a CT scan. You can't do it with an X-ray. You can do various things with ultrasound. You can do steroid injections under ultrasound. You can do aspirations under ultrasound. That's all just a few of the things that I use point of care ultrasound for. And like I said, I use it every day. And there's massive value in it, and it's also safer for our patients. So why not?
And I think you touch on a number of points over there, but the one I want to double click on here is just the level of efficiencies, and also your real heart from it comes from the fact that you're able to deliver better care, more efficient care, more accurate care, and at the same time, you as a clinician are feeling like you're upskilling yourself constantly as you're going through this process. So as you begin to understand what these tools can give you, it just helps in every facet, from you as a clinician for your own personal satisfaction, feeling that you're developing in your career, but also the clinical outcomes that these patients get just by adopting these technologies and these new breakthroughs in medical care are self-evident. That you're able to do this. And I like to then segue from that and maybe go a little bit off the medical care.
Okay.
To speak about Roland, the manager. We have very few, or at least when I was in clinical practice, very seldom do we speak about the soft skills that are required to be a good healthcare leader. You, who is leading again, one of the largest, or the largest CHC in this country, there's a lot of skills you need outside of healthcare, outside of your medical training, to be able to do the things you do. Who have been some of the, I mean, you mentioned some of your parents, some of the mentors you've had, but who are some of the people that you've looked up to in the past as well, that have guided your thinking? But also, what are the skills that you feel that you would need if you're going to be a leader of a team of clinicians that's delivering healthcare to a vast number of patients, to make sure that your impact is good within the community?
It's an interesting one, because I don't think anyone can particularly, you can look at different management styles, obviously, but I think the easiest for me is to look at something closer to my values, closer to who I am. So you are managing doctors, but other things as well. There's a number of things you need to be sensitive about. Everyone's got a life, everyone's got a family. There are certain things you need to support some people with. And then there are some places where you have to draw hard lines and say, this is it. We can't go over this. But what can we do? How can we assist you? The other part of management, obviously, is the hands-on type stuff. If you want to manage something, you need to understand how things work. And in the clinical space, you need to be in the clinical space. You need to work the clinical space, understand what is the challenges in order for you to implement new things. So you need to be hands-on, understand, and not just be a manager, but you don't understand the clinical setting by not being in the clinical space. So you need to understand all of that in order for you to come up with a solution. But important as a manager, there are different people that are specialists at a specific facility in the area. You have healthcare promoters, HCPs, you get the healthcare promoters, that's experts in their field. If it's something to do with pharmacy, the pharmacist will know exactly. If it's something to do with medication collection, the pharmacist probably the more appropriate person to ask about. If it's something to do with EC, maybe the EC operational manager or the doctors that works in that area. So depending on the various challenges you have, I think it's important to lean on your colleagues as well.
Yes.
And not just accept things as you as an individual to sort out certain things. It's always a team approach. And and you must accept along the way you're going to make mistakes.
Very important. Be kind to yourself, eh?
You have to accept that, because nobody's perfect.
Yeah.
But if you're a lifelong learner and you're prepared to learn every day and not to accept, I'm always right, and look at other people's point of view as well, you will grow as you go along. The same for me is I still learn every day. I don't think I'm perfect in a management role. There's bits and pieces that I've become much better at over the last 6 years, but it's a work in progress. I don't think you can ever get a perfectly round off leader, but always have an open door for other people at facility, and whether it's the people that you're supervising or other staff for that matter. And once you get to know the people that you work with a little bit more about the background, like I've told you when we started the podcast, then you start to understand a bit more about them in terms of how to support them, and where they're really struggling, and lean into that a bit more in order to get the best out of them. Because over time you learn what's the things people suffer, have difficult with, and then you learn things that they're quite good at, and you want them to bring the bits that they're good at, and you need to find a way to balance that and support them with the things that they're really struggling with.
You seem to take a great interest in your people and what they can bring to the table. I've heard you mention it now several times through this discussion, and I think if more, because sometimes in healthcare it can be very, if you look at the old school, the way healthcare used to be very patriarchal, and that, you had the big guy on top, and he would sort of, command his minions below him to do his bidding. but you seem to have more of a consultative approach where you have people around in a circle and they look to you for leadership, yes, and you have to make hard decisions, but you take into consideration what they might have to say. And this isn't the direction I wanted to really take this podcast in too much, but it's something I would be remiss if I didn't ask. We have a crisis in healthcare in South Africa at the moment where doctors are feeling overburdened, pressured. You grow up in a very hostile environment in your training, and because you have to make very difficult decisions. Do you think if we had more of a training upbringing, I suppose, where we had more of a consultative approach, that we would develop more healthier, more balanced clinicians? Or do you think that we just have to be put through the fire and tested, and then hopefully we come out the other side, survive, and we can fix it afterward?
That would be a difficult one, because I can tell you that in the public space, we are very much driven by targets. Targets might make it very overwhelming for a lot of people to actually maintain their space in the public sector, because there's a lot of targets. But I think we have to stick to the basics. I think number one, we need to remain motivated. Other people need to see it works with you, and you need to get the other people on the same page with you. And I think it's important to lead by example. Quite often we forget that other people look at you and the way you manage certain situations. So you have to lead by example. And then, like I said, there's no I in team. If you can work well as a team. And then one example of that is, I was an intern at Geefhuurster Hospital when it still existed. People had a lot of bad things to say about that place. But the one thing I love about that place, everyone that worked there, they worked hard. And they enjoyed working together. And to me, Geefhuurster, my memory of that is, and there's a lot of people that's top specialists today that is still around that was with me at Jooster.
They cut their teeth there, yeah.
And we worked hard, but I enjoyed working with the people that we worked with because we all had a common goal. And that made me enjoy that year of internship so much. Just to show you, it's not the building. It's about the individualized care that's been rendered by healthcare providers and the patient-centered care that's been rendered by healthcare providers. So for me, that's the one thing that's quite evident from the past, and it's shaped a bit of what we're trying to create here and what we've created. So so that's with me.
So, bit of a contentious question, but I want to ask you anyway. If you could change one thing about South African healthcare and how it runs, where would you start?
The Western Cape obviously is different compared to the other provinces. Over the last 6 years, there's been a lot of changes in the public healthcare system. There's a lot of new things that were introduced. There's a lot of new innovations. There's a lot of advancements compared to 6 years ago. It's in a much better place than what it was six years ago. To be honest, 2 years back, before we had austerity measures, the gap between public service and private service was small. From my personal experience, because I've been working in the sector, the gap was small. And with austerity measures, the gap just widened. And I'm always of the opinion that the public healthcare service is not second to private. I think the two can coexist pretty well. We haven't found the perfect or the sweet, I call it the sweet spot, but the perfect medium for the two to collaborate. We haven't. There's bits and pieces of it in the rural space, but in the metro, we haven't found that perfect medium for the two to coexist and the two to benefit each other in a big way. Public service can't exist without private. Private service, healthcare service can't exist without the public service. I think something we can change is to get that collaboration, that perfect medium, we must still find it. So there's opportunity there that we haven't explored yet.
I just came from a conversation with Dr. William Maypham, and or Pam, I might be pronouncing his surname incorrectly. Forgive me, William. But he was talking about the exact same thing, about trying to find ways for public and private to hold hands. I suppose this is where this whole NHI conversation is coming from, is that we have these two systems that seem to touch each other at intersections. And I think anyone, myself included, who's worked in both the public and the private sector can attest to the fact that the quality of the care, there isn't actually a gulf in difference, really. The quality of the care is almost exactly the same. It's just the aesthetics, what is it dressed in?
Yes.
And the time response is that you're sitting with a million people that you have to serve. A primary care doctor around the corner here doesn't have to serve that many people.
Yeah.
His response time is quicker than yours can be. Yeah. But once that patient is in front of you, the quality of the care rendered is exactly the same. He might have some more tools available to him that you might not have available to you, but the intention of the doctor behind them is exactly the same. And because they come from the same facilities in terms of training, the upbringing is the same, the quality of the education is the same. So I think that intersection there, trying to find ways that public and private can hold hands together, is I suppose the big question of the day that we're trying to answer. And it comes to the same, you came to the same conclusions yourself, that that's probably the one thing you'd want to change.
There's one thing that we can be better at. It's that particular collaboration, because the two needs each other to actually coexist as a healthcare system. They have often been seen as complete opposite ends of the spectrum, but they are not. I think the two can work much closer together, and patients will benefit. The whole system will just benefit if we can find that perfect medium. But motivation for private and public is different. Public, we want to patient outcomes is at the center of what our motivation is.
Price public,
Whereas in private, a bit more funding.
Yes.
So the opposite ends of the spectrum in terms of what they want to achieve, but there should be a way to actually marry it properly and get a better outcomes. There's a lot of things in public space that private doesn't have. Just from my experience of knowing a bit about private services and public services, we've got a lot of useful tools in the public space which is universal across the province, which private doesn't have, because there's different private healthcare groups, whereas in the public sector it's all centralized. I mean, if you can look at results of a patient that was seen elsewhere in the province from this facility, a patient you've never seen before, that doesn't have documentation with him, but they've got a whole electronic record that actually follows them, and you're able to access that. And we've got that in the public sector, which in the private sector it doesn't exist. It's a form of an electronic health record. So there's a lot of positives from the public space, and there's positives from the private space. Obviously, specialized investigations, there's a lot more access to that, which we don't have access to, although it's been paid for. But in the public space, it's a lot more limited.
Yes.
So if we can find some people that would love to make this work and start the process, I mean, it's gonna add a lot of value to the whole of South Africa. If it starts in the Western Cape, that's one thing, but it can always be escalated elsewhere.
Well, I mean, just coming into land on this conversation, the fact that you've come to those conclusions from your lived experience on the ground speaks a lot to the public discourse we're having around healthcare at the moment in South Africa. And it's again a testament to the fact that we need to continue having these dialogues to make sure that we find the right solutions to get to the best outcomes we can possibly get to for all people of South Africa, whether you have medical aid, whether you don't, whether you're going to public, whether you're going to private. And I'm, for one, encouraged by the work that you're doing over here. I see firsthand just the way that you run this department, having known you for quite some time now and having some special insight into what you guys are doing over here, and just seeing, despite the burdens that you have to carry with the sheer population size that you have to manage, you're still able to create a workable healthcare system that is efficient for all, you know. But I want to find out more about your own personal legacy, and maybe just as a final question to you, Roland. What do you hope, when you look back on your career, that you'll be known for? Not just the clinical care you've rendered, but maybe also the innovation that you've been able to bestow upon the industry. What do you hope you'll be known for one day when you decide to hang up the stethoscope?
So something very close to my heart is digitization of healthcare services. Very close to my heart, moving away from paper, and something that I'm pushing for very hard. A lot of people that know me knows that I'm pushing hard for that. What comes with innovation for me is not the innovation itself, but creating systems that's sustainable. So whatever innovation you put there, years after I'm gone, it must still be going, because it's not an effort or difficult for people to keep it up or keep it going or maintain it. So I think the legacy that I want to leave is, I guess if you're a big Springbok supporter, you'll all say, leave the jersey in a better place, but it comes down to the same thing. Yes. Leave the healthcare service in a better space than what you found it. We're all here to contribute, to add value to a really big and a powerful system. And if you can leave a lasting impact by leaving something that can be maintained for years to come and make a difference in so many people's lives, that's the legacy that I want to be known for. Yeah. Not my name. I want to be known for systems that's sustainable, that contributed a lot of value to the healthcare of the people living in Mitchell's Plain. So that would be it.
I think you're well on your way there, and I think the external recognition you've also received through the multiple awards you've gotten for the way that you've managed Mitchell's Plain CHC, to the innovative solutions you've brought to healthcare facilities as well, that are now, I believe, being rolled out nationwide as well. I think, is something that is a testament to the work you've put in and the legacy you hope to leave. So I wish you the best of luck in your career, and I hope that we have many more conversations like that. We'd love to have you back on the Vital Insight podcast in the future, just to catch up with you and find out what you're up to, and see what further breakthroughs and innovations you hope to champion in the future. Even if you've already done so much, but even if it's just to find out what the biggest CHC in South Africa is up to, I'd love to have that conversation going forward. So thank you so much for your time. I really do appreciate it.
Thanks for having me.
Big pleasure. And thank you to you for spending some time with us here at the Vital Insight Podcast. As always, if you've enjoyed this podcast, then please do give us a like, subscribe to our YouTube channel and all of our social channels as well, if you'd like to find snippets and tidbits and pieces from this podcast here today. It's always such a pleasure to unpack these insights with leading medical and healthcare professionals, and to really understand in particular what is driving healthcare innovation and technology forward in South Africa and beyond. If you'd like to engage with us, please do send us an email. Our details will be in the description below. And if you'd like to reach out to us directly, either via our social channels or by leaving us a comment, we'll do our best to engage with you. Thank you so much again for spending some time with us. My name is Basil Johansen. I'll see you next time.